Today I'll be talking about From Midwives to Medicine, The Birth of American Gynecology, which is a book published in the late 90s, written by Deborah Kuhn McGregor, who's a historian in women's 19th century history. This text eloquently describes the birth of American gynecology, thanks to the biography of the famous Marion Sims, as well as following the history of the women's hospital founded by Marion Sims and others. The most interesting part of the book is how it really explores the idea of race, class, and gender in medicine and the development of new medicine, and it is a great way to self-reflect on modern medical practices. So, Marion Sims was born in the antebellum South. And quoting, the social system surrounding Sims' early medical career promoted a clearly visible hierarchy of man according to race. This meant that Sims had access to slaves in order to operate on them. Most notably, slave women were imposed the role of reproduction and trying to produce more slaves, especially those on plantations. For this reason, Sims' first operations on vesicovaginal fistulas were on Anarcha, Betsy, and Lucy. Anarcha actually underwent 3.5 years of experimental operations, and she had up to 30 surgeries, and in June 1849, she was returned to her owner. She was actually the reason that Marion Sims invented silver sutures, which were hypoallergenic. So McGregor begins to paint the picture of mid-19th century with the shift in the field from midwifery to gynecology, which was now challenging the centuries-old practice of midwifery and female-governed childbirth. Thanks to the rise in male physicians, which meant that things were discarded, such as the use of ergot, which was a common painkiller used to speed labor. With this, the history of the women's hospital begins. It was founded in 1855 by Marion Sims and Thomas Addis Emmett. It was only for the treatment of diseases peculiar to women. Although at the time Elizabeth Blackwell became an influential figure, the Board of Lady Supervisors were adamant in keeping women's roles as just nurses or a part of the administration. And this was seen when Emily Blackwell was not placed as assistant surgeon despite her excellent abilities, which was actually a choice imposed by Sims but also strongly supported by the Ladies' Board of Supervisors. The women's hospital did have qualities such as the lack of segregation within it. Despite this, and with the actual introduction of anesthesia, popularized a decade earlier in 1846 by William Morton, Sims and other doctors administered anesthetics only based on the wealth and whiteness of their patients. From the get-go, the hospital was also a school of medicine, which was crucial for the development of gynecology. And often patients had very little privacy and had dozens of people looking in at the surgeries. In 1861, Sims left for Europe, and Emmett became the surgeon-in-chief of the hospital. During this period, there was also new awareness on the ethics of medicine, and very significantly, in the 1850s and 60s, the surgeon Isaac Barker Brown preferred numerous hysterectomies to cure nervousness in women, without actually telling his patients the consequences of the surgeries. And in 1867, the London medical community censored him by removing him from the British Obstetric Society. As it developed, the Women's Hospital also began to adhere to Florence Nightingale's idea of what hospitals should architecturally be like. As a result, he sought ideas to actually build a whole new women's hospital. Unfortunately, in the 1860s is when the American Civil War began, which caused a lot of issues. Tensions ran rampant in the hospital. Funds were low, and this was quite a big issue. However, the hospital was able to somewhat recover from this. And the ending of the book highlighted that in 1876, Sims, Emmett, Thomas Piesel, and several others founded the American Gynecological Society. Gynecology was now a medical specialty, and the practitioners of the women's hospital were at the center of it, which is extremely significant. I would recommend this book to all my female colleagues, because gynecology pertains to us as women, but also to all medical students who are interested in the birth of this great branch of medicine, as it is very illuminating and shows the roles of race and class in medicine. Thank you for listening.